Welcome to Lesson 2 of our DSM-5-TR series. Today we will focus on one of the most important neurodevelopmental disorders, intellectual developmental disorder, also known as intellectual disability. This disorder begins during the developmental period, usually before the age of 18. It is defined by significant limitations in two main areas, intellectual functioning and adaptive functioning. Let's start with intellectual functioning. This refers to mental abilities such as reasoning, problem-solving, planning, abstract thinking, judgment, academic learning, and learning from experience. Individuals with this disorder often have significantly below-average performance on standardized intelligence tests, typically an IQ score around 65 to 75 or below. However, diagnosis is not based on IQ alone. Clinical judgment and a comprehensive evaluation are essential. The second key area is adaptive functioning. Adaptive functioning refers to how well a person meets the cultural and social standards of personal independence and social responsibility expected for their age group. It is divided into three main domains: conceptual, social, and practical. The conceptual domain involves skills such as language, reading, writing, math, reasoning, knowledge, and memory. The social domain includes empathy, social judgment, communication skills, and the ability to form and maintain friendships. The practical domain refers to skills like personal care, managing money, organizing school or work tasks, and living independently. According to the DSM-5-TR, three diagnostic criteria must be met for a diagnosis of intellectual developmental disorder. A. Deficits in intellectual functioning, confirmed by both clinical assessment and standardized intelligence testing. B. Deficits in adaptive functioning that significantly limit the individual's ability to meet standards of personal independence and social responsibility in daily life across conceptual, social, and practical domains. C. The onset of these deficits must occur during the developmental period. The DSM-5-TR classifies intellectual disability into 4 severity levels based on adaptive functioning, not just IQ scores. These levels are mild, moderate, severe, and profound. Mild intellectual disability is the most common. Individuals may develop social and communication skills and achieve academic abilities up to an elementary school level. They can often live independently with minimal support. Moderate intellectual disability involves more noticeable delays in language and academic skills. Individuals may require ongoing support in daily living and are unlikely to progress beyond elementary academic levels. Severe intellectual disability involves very limited communication skills and significant support needs. Individuals usually require extensive assistance with daily activities. Profound intellectual disability is the most severe level. Individuals have very limited communication and require constant care and supervision. It is important to note that intellectual disability affects about 1% of the population. The severity and presentation can vary greatly depending on genetic, environmental, and social factors. Some common causes include genetic syndromes such as Down syndrome, prenatal exposure to alcohol or infections, birth complications, or postnatal factors like brain injuries or infections. Cultural and social context also play a major role in diagnosis. What may be considered a limitation in one cultural setting might be typical in another. The DSM-5-TR emphasizes the importance of understanding cultural expectations when assessing adaptive functioning. There are also special diagnostic categories. Global developmental delay is used for children under 5 years old when it is too early to accurately assess intellectual functioning. Unspecified intellectual developmental disorder is used when assessment is limited due to conditions such as severe physical or sensory impairments. Finally, intellectual developmental disorder often co-occurs with other conditions such as ADHD, autism spectrum disorder, mood disorders, and epilepsy. Accurate diagnosis is essential because it informs treatment planning and support strategies that can greatly improve quality of life. In summary, intellectual developmental disorder is a lifelong condition that affects both intellectual functioning and adaptive behavior. Diagnosis requires careful evaluation of symptoms, their impact on daily functioning, and their onset during the developmental period. With early intervention, educational support, and appropriate services, individuals with intellectual disability can achieve greater independence and lead fulfilling lives. Thank you for watching Lesson 2 of our DSM-5 series. In the next lesson, we will explore communication disorders and their key diagnostic features.